Hi, my name is Peter and I invented a new way to visualize bone with MRI. It actually all started at the University Medical Center in Utrecht, where I was working on a project aiming for visualization of metal seats used for radiotherapy purposes. So I developed a dedicated MRI sequence and it was actually quite successful. We visualized those metal seats, but also the bone in the neighborhood. And this was stunning because normally with MRI you're only visualizing the soft tissue. Of course I wanted to share this to others. I went to the room next door to Marijn van Stralen to ask his opinion on this new idea.
I was amazed. What Peter found was revolutionary, because if you can image the bone using MRI technology, first of all, patients are no more exposed to ionizing radiation, which might cause cancer at a later age. Secondly, it's a one-stop shop, saving time and costs, and patient burden is reduced because they only need to undergo one imaging exam. Thirdly, for healthcare professionals, they get better diagnostic information, getting two images intrinsically aligned, which is optimal for diagnosis and treatment planning of pathologies where information about both soft tissue and bone is required.
There's a lot of unused information in existing MR data that can be exploited when you have a deep understanding of the MR physics and AI principles. So we have been able to unlock that information, generating bone MRI reconstructions, which provides new opportunities for radiology and surgical planning.
So we had to unravel this hidden data. And that's why in 2016 we partnered up along with medtech entrepreneur Roel Raadgever to found MRIguidance. And with the support of the acceleration program of EIT Health, we started developing our algorithms to build our software solution called BoneMRI.
Since we have CE mark and FDA clearance, BoneMRI is more and more used in hospitals. We have those marks for the lumbar spine, the pelvis and the cervical spine. Professor René Kastelein was involved from the beginning in the development, and he also was one of the first ones to use it in his clinical practice.
Indeed, I remember receiving a call from Peter a number of years ago explaining me about the option of the bone MRI. And I must say I was immediately very triggered, because in my work I need to have 3D imaging of bony anatomy in combination with the adequate imaging of the neural structures and the intervertebral discs. So I was relying on CT scan in combination with MRI scans, but at the same time I was getting more and more concerned about the radiation burden for my patients. So the option of having one modality like an MRI scan providing me the bony anatomy in combination with the soft tissue structures really appealed to me. But I must admit, in the beginning I was a bit concerned about what that might mean for my workflow.
So I explained how BoneMRI is seamlessly integrated in the workflow. The patient is being scanned, the data is sent to PACS. We take the data and reconstruct the BoneMRI images, which are then sent back to PACS. In the exam you'll find the bone and soft tissue images, which are then displayed at the radiologist and surgeon's workstations.
Nonetheless, after having received all this reassuring information, I was still a bit concerned that it might not work on all the MRI scans that I was used to working with.
Which is completely understandable, but we are vendor agnostic, which means that BoneMRI works on most common brands like Philips, Siemens and GE.
So indeed, after I had seen a demo, I was really astonished, because the images looked exactly like the CT scans that I was used to. And I even saw options for radiation-free navigation.
We are more than happy to explain and show this technology that is accelerating the world's transition towards a radiation-free medical imaging. Book a demo.